The surge of infections that our experts and scientists predicted over 3 months ago has now arrived. This is in our collective hands. Let us remember that every individual action that we undertake does and can make a big difference. Let us also remember that whether we are a family with an infected member, a business owner worried about their staff, or a parent concerned for the safety of their children, that none of us stands alone.
South Africa has the 5th highest number of COVID-19 cases in the entire world. Yes, number 5 out of the globe's 195 countries. And this is only based on yesterday's results of 364,000 cases, which is expected to increase today when Minister Zweli Mikhize releases the daily updates later on this evening. What does this all mean? What does it say about our measures? What does it say about our behavior? Yes, you and I. Doctors and nurses are complaining about emotional and mental fatigue. Hospital spaces are drying up. And as if this is not enough, corruption allegations are spreading like the pandemic itself. A mouthful, I know. And not such a good evening, but welcome. We are going to help you make sense of it all. I'm Aldrin Simpier, and this is Unfiltered. Our guest this evening is Associate Professor of Politics at the University of Johannesburg, Professor Mcebisi Ndlejana. We'll also be joined by Professor Adrian Purin, who is the head of the Center for STIs and HIV at the National Institute of Communicable Diseases. And we'll also have Kilebohile Kuno, who is a researcher at the Socio-economic Rights Institute, SERI. Remember, you can be part of the conversation by going to our social media platforms and using the @SABC News handle, and also using hashtag SABC Unfiltered. That is hashtag SABC Unfiltered. We'd love to hear what your take is on all the measures that have been put in place. When we come back, our guest. Okay, I think we have Kilebohile on the line. Kilebohile, good evening and welcome to Unfiltered. From the research that SERI has done, first of all, let's start off with the economic impact, or the socio-economic impact of COVID-19.
Hi, Aldrin. Thank you so much for having me. From the research that we have done, we have been consulting with domestic worker organizations, with informal trade organizations, with people who live in the inner city of major cities like Johannesburg and Cape Town. And the situation is dire out there. We entered into the COVID-19 crisis as a country with very serious developmental issues, high levels of poverty, high levels of unemployment. So we found ourselves in a situation where we had to, at the same time as we're talking about social distancing and taking precautions not to spread the virus, we were in the situation where we had to balance that with allowing people to work, people to make a living, to support their families, or coming up with other interventions from the state that would assist people to have an income in this period of time that we're living in. And so what we're seeing in terms of our informal workers or the informal sector, or even just precarious workers like domestic workers, is a lot of loss of income. And we're also seeing that the state has not been able to support that loss of income for many informal workers.
And let's speak about looking at the measures that the state has put in place. And all of these measures have been put in place, number one, to flatten the curve, to get all the state functionaries, including the hospitals, ready for the COVID-19 peak, which we are currently going through. The president saying that we are in the eye of the storm. But very importantly, at the same time, with all of those measures that have been put in place, we find ourselves being ranked number 5 in the entire world.
Yes, I think, just as I said before, that we come with the history of very serious developmental problems, which meant that balancing the social distancing and making sure that this virus does not spread, we had to balance that with opening up the economy so that people are able to work. And so that has led to a lot of issues. We're seeing increases in the spread of the virus, but at the same time, we're also seeing people still being dismissed, people still facing retrenchment. And so we're in a little bit of a debacle at this stage.
And I think the difficulty with it is that if you take into consideration that we've put in place all of these measures, the jobs that you've just spoken about, people losing their jobs, and some also taking salary cuts. And at the same time, with all of these, we still rank number 5. So it almost seems that for citizens, at least, we are losing on both ends.
It does indeed seem like that. I think this is a serious wake-up call. I'll use the example of domestic workers and informal traders. A lot of what these workers who predominantly fall in the informal sector have been advocating for many years and have been in consultation with government for many years is the recognition of their work as real work. Yep. That they make a significant contribution to the economy and therefore should also benefit from social protections that we saw at the beginning of the lockdown. Many social protections were provided to formal businesses, to formal workers. They were able to access the temporary employer-employee scheme, for example, whereas a lot of these informal workers were not given those benefits, or the access to those benefits had been made very difficult in the initial stages. And we're not talking about small numbers. We're talking about 1 million domestic workers, and according to Statistics SA, about 3 million people working in the informal sector. And understand that that number of people is supporting an even larger number of their families and relatives. And so, if you know, my feeling is that if the call had been heeded for social protections to be extended to the workers in the informal sector, then the pressure to open up the economy from their side anyway would have not have been there, because they would have had a safety net to fall back on. Many domestic workers have to now reconcile going back to work and facing, the chance of contracting the virus either in public transport or in the homes of their employers, or not having not having food to put on the table. Yeah. It's a very difficult position to be in, and it's a position that they should have not been in the first place.
You raised the issue of public transport and specifically the taxis, and there has been a back and forth currently that's underway between Labour Federation, COSATU, as well as Santaco around this 100% taxi capacity. From the state side, and what the state has explained, and listening to Minister Zweli Mikhize saying that they have consulted health experts, and from the information and the research that has been done, they feel that taxis can load 100% capacity, even though we know that the WHO is insisting and saying as part of its advice to countries is that adhere to the regulations around social distancing.
Yes, so I'm not a health expert, but what I will say is that it is concerning that the information that we're getting from international organizations like the WHO is not necessarily being applied in our country. In this instance, as you give the example of taxis. For me, the major concern for me is that for many people, for many South Africans, they don't even have the choice to even enter this debate, because to be able to support their families, they're going to have to take public transport and risk getting the virus. And I think this is a significant juncture in the life of South Africans and in our country. Something like this cannot happen again. I think this is a huge wake-up call for many different government departments, whether it's the Department of Labor or the Department of Transport or the Department of Health. This is a significant juncture where we need to put in place we need to address a lot of the structural issues that we knew were there, but we're seeing, the devastating impact of not having addressed those issues in the past before this crisis.
Do you think that there is a need, at least for the government, to revisit that particular decision around the 100% capacity? Also taking into consideration that if you look at the stats here in Gauteng, which currently has the highest number of infection rates, areas such as Soweto as well as central Johannesburg, those areas are mostly affected.
Yeah, so I think those decision makers would need to watch very closely the rates of infections. We're not at that stage where we're like looking at a week by week basis, on a daily basis.
Yeah.
And it seems like, the rate is increasing, and that decisions have to be made to address issues like this.
And how do you address those issues? And the other question that I actually had when prepping for this evening's conversation is, at the NCC level, and I know that you guys have made some submissions to the NCCC, who represents the poor?
Exactly. I think. To answer your first question about how this issue of transport can be addressed, I think, yeah. So, like I said before, the issue is that we're coming into this pandemic with very serious, deep structural issues that needed to be addressed way before something like this happened. But in terms of who represents the poor, I think it was very clear, in the very early stages of the lockdown, and a lot of the addresses by government ministers and the president himself, that there wasn't any group that was being consulted. When I speak to domestic worker unions, I've spoken to informal trader organizations. One of the major problems is a lack of consultation and engagement with them, and this is seriously concerning. Although I must say that through a lot of collaboration between these organizations and other civil society organizations, we have been able to make inroads in engaging with government and advocating for certain things to be done, and have actually achieved those things. So, I think those achievements, while good, really, they were hard won, and I think the hope rather is for, instead of civil society organizations having to really spend a lot of time just advocating to be heard, that rather than taking that route, we should take the route of actually beginning to see now that we need to collaborate very closely between organizations on the ground, individuals on the ground, and government, especially when it comes to life and death decisions, which really in the case of the pandemic is what it comes down to.
Okay, thank you so much for that. We'll continue the conversation after this break. Remember that you can be part of the conversation by tweeting your comments as well as your questions using the hashtag SABC Unfiltered. That's hashtag SABC Unfiltered. You can also use the handle at SABC News. And welcome back. You're still watching Unfiltered with me, Aldrin Simpier. The question we're asking you this evening, do you think that we're losing the battle against COVID-19, considering that we are now number 5 in the world with the highest number of COVID-19 cases? So that's where we stand at the moment, still waiting for Minister Zweli Mikhize to release this hour's, or rather today's results, and what indication those results could give us in terms of our ranking currently. Currently number 5 out of 195 countries across the globe, with the number of infections that we have, over 360,000 from the previous number. To join me for this conversation right now, we have Professor Adrian Purin, who is the head of the Center for STIs and HIV at the National Institute for Communicable Diseases. We still have Kilebogile Kuno, who is a researcher at the Socio-economic Rights Institute. And remember that we'd love to hear from you using the hashtag SABC Unfiltered. That's hashtag SABC Unfiltered. You can also use the handle at SABC News. Prof, are we losing the battle? Good evening.
No, I don't think we should put it in those terms at all. I think what we're experiencing is what I think we predicted in terms of the initial phases where we thought we could try and contain the virus, but we soon realized that that was not possible. And therefore, we put in measures to ensure that although we would have transmission, we would actually be ready to manage the surge of cases that we would expect to see. And as you know, we've had various mathematical models that have actually shown that we would have surges of cases as we are currently seeing. And it's really, I think the concern is around if those surges result in overwhelming the health system, that is certainly going to be problematic. But I think it's not that we've lost the battle. I think that we still have within our capabilities, in terms of the non-pharmaceutical interventions, ways in which we can actually prevent transmission of this particular virus. So it still comes back to those key messages around the physical distancing, the hand washing, hand hygiene. The physical distancing, as I've already mentioned, is really critical, and the wearing of masks. So I think within those contexts, we are still able, as far as is possible, to try and prevent a transmission.
Are we saying that we are still able to contain the spread of the virus, but also on the other end, we have somewhat failed around how quickly we can contain the spread of the virus, considering that right now we are ranked number 5?
Yeah, so we've had a massive surge, I agree with you. So there is large spread, widespread community spread. However, if you look at those particular numbers, in terms of the total population level, it's still a fairly small number in terms of the total population that has actually been infected. And if you look at our mortality rate, I know we could discuss the excess mortality rate, which is somewhat different. But if you look at our mortality rate, it's still less than 2%. So yes, we are going to see surges. It will certainly increase, but it does not mean that we're going to have the whole population, or 60%, to reach herd immunity within this particular first phase or first surge that we are currently seeing. So I think there are ways. We do know, of course, that the large proportion of individuals that are going to be infected will have a mild course of disease and will actually come out of that with very little sequelae.
Sure.
It's that small proportion of individuals that are going to end up in our ICUs and our high care that we've got a great deal of concern about, because we do know that we have obesity is a major problem in this country. We do know that hypertension, diabetes mellitus, and all these diseases are linked to each other, these non-communicable diseases, and these put those individuals at high risk. So it's those individuals that we are really concerned about. I think the majority of people who will be exposed to this virus will actually survive.
Prof, I hear you, but I don't know. I'm still a bit skeptical. I don't understand how we got to rank number 5 with the highest number of cases, considering that we're speaking about 195 countries. So out of 195 countries, we are right up there next to the likes of the USA, you have Russia, you've got India, and with India, with India, for instance, we're speaking about billions of people. Over a billion, the population.
Sure. So we don't have much in terms of interventions in terms of on the medical side, in terms of a vaccine or any other medical interventions to prevent transmission. We have a very difficult situation in South Africa in the sense that we had that initial physical lockdown, the level 5. However, we've then gradated, moved from a level 5 to level 4 to now level 3. And obviously, certain communities do find it very difficult, if not impossible, to actually have all these necessary instruments to actually protect themselves, such as the physical distancing, the hand hygiene. You have to travel in at taxis that are full. You have to be at work where, again, you may be in close contact where protocols are not being adhered to. So my sense is that for a fairly large proportion of South Africans finding themselves in high-density areas, as we've seen in the Western Cape, in Gauteng, KwaZulu-Natal, the likely explanation is that we've had initial seeding, we were unable to contain the virus, and when we had the lockdowns, and that started at level 5, in fact, even though we initially were able to control some level of transmission, we were not fully successful in terms of the controlling. Therefore, you are seeing this wave or surge of infections that reaches to, as you said, the level of number 5, for example. So if you look at other countries, they certainly have not. If you look at the United States, for example, is a country which ranked quite highly in terms of preparedness. In fact, their approach was not, in fact, to do much testing. In fact, the UK as well also had this approach about let's have herd immunity as a potential way of getting our way out of this particular epidemic. And the consequences are, the UK is a good example of that, where you have large numbers of people being infected because those particular measures of restriction weren't placed, the level of testing, tracing, and tracking were not in place. So we were in a similar position. If you recall, we had this unique curve And then now we're seeing the surge like all other countries that we're currently seeing.
Yeah. Kilebogile, from some of the people that you have engaged, what are they saying about the ability to social distance?
So social distancing has been a challenge for particularly people who live in high-density areas such as informal settlements or inner-city buildings. In the case of informal settlements, the structures themselves are very close together, but then you also find that you have multiple people living together in households. In terms of the economic impact, I guess, is the fact that people have to go to work and use public transport, as I had mentioned earlier, but also a family's ability to have enough savings to be able to buy a large number of groceries to keep so as to avoid going out every day is very limited in the cases of low-income households. So it has been a difficulty being able to physically distance in such situations.
Yeah. And Prof, what do we say about people who have been failing to comply? So Kilebogile mentions those who are struggling to comply because of the density and how dense those areas are where they live in, but those who are outrightly not complying, overtly so.
Yeah, so again, it comes back to our communications and how we actually nudge those individuals to really understand that, yes, you may be in the category where you may actually survive this disease, you may have a very mild outcome, for example, but there is a responsibility as you are part of a community in terms of transmission. So remember, there were some debates about the wearing of masks, for example.
Yeah.
There was a great deal of discussion that, in fact, the evidence was lacking or poor, and therefore, we should not be wearing masks. But as you know, the WHO did change
that
its
as well.
Yeah, so in fact, yes, they had that particular position essentially because they said that if everybody started wearing N95 masks, the healthcare workers would actually be at a disadvantage. And therefore, that certainly influenced the discussion. But I think there was a growing level of evidence, for example, to show that at least the wearing of at least the homemade masks or the cloth mask would actually have some level of protection. It's not fully protective because of the nature of that particular handmade mask. So I think it's really trying to stress that. It's really a cultural change, if you like, because if you look at the countries where masks are a routine part of life, especially in Eastern countries, for example, in Asia, for example, there's good evidence to show that, in fact, those types of activities are really important. They're now integrated into the societies. And I think that our particular society, sometimes a very individualistic society, does not gear itself up to actually taking those particular instructions very seriously in terms of what it actually means. So that protective principle of protecting not just myself, but you is something that still needs to be inculcated in our society. Okay,
so we're going to go to a quick ad break. When we come back, we continue our conversation looking at some of the measures now that have been put in by government. For instance, number one, we can speak about the 100% taxi capacity. Number two, the sell or the ban or the lifting of the ban on the sale of alcohol, and also the communication between the state as well as citizens and whether they are receiving that information and how it is that some citizens feel that the government is not consulting enough. That conversation just after this. To our SABC 3 viewers, goodbye, but the conversation continues on the SABC News channel on 404. And welcome back. You're still watching Unfiltered with me, Aldrin Simpier. So another guest that we're introducing for this conversation is Associate Professor of Politics at the University of Johannesburg, Professor Mcebisi Dlejana, who joins us for this conversation. We still have Professor Adrian Purin, who is the head of the Center for STIs and HIV at the National Institute of Communicable Diseases. And we also have Kilebogile Kuno, who is a researcher at the Socio-economic Rights Institute, SERI. And remember that we'd love to hear from you. You can tweet at SABC News, that is at SABC News, and use the hashtag SABC Unfiltered. That is hashtag SABC Unfiltered. Professor Dlejana, good evening and welcome to Unfiltered. Earlier on, I was asking Prof. Adrian earlier on about whether or not we are losing this battle against COVID-19. I'd love to hear your view on that.
Well, good evening, Adrian. I don't think so. I don't think so because the spikes were, as far as I could tell, were not entirely unexpected, especially when you relaxed regulations, allowed people to move around. There was always a risk that when you allow those movements, you would have a much wider spread of the transmission, especially because South Africa is what it is. You have informal settlements that are pretty much built on top of each other. South Africa is not Germany. So if you are to make a comparative study, you can't say just because it's going down in Germany or France, therefore South Africa should necessarily go down. I don't think France has the kind of squatter settlements that we have. I don't think they have the taxi drivers that we have who insist on having full loads, and some of them don't even observe the wearing of masks. So to say that it is getting out of control, for me, I think it's well, there are spikes.
Yeah.
The spikes were not entirely unexpected, but the issue, I think, should be, have we made enough provisions? Because they foresaw this spike, right? So have we made sufficient provisions to provide beds and things like that? But the fact that we have spikes should not, it's not really a profound point to make because it was really expected given the configuration of our settlements and the kind of problems that we have in efficiency, especially in the administration.
Yeah, but then considering, for instance, the issues that you raised now around how densely populate our densely populated areas, including informal settlements, and then you speak about the taxi industry that, well, as we can see, is clearly a law unto itself. That certainly must say something about the state's role in all of this as well, or the failure of the state to act on this.
You see, when we look at what is happening now, we shouldn't look purely at what is happening in the here and now, but have a broader understanding of what the nature of the South African public service is like. Because ultimately, it is the bureaucracy that has to respond to this. So the question is, have we always had a bureaucracy that was geared towards meeting the challenges of a crisis like this, right? So we shouldn't be surprised that there are no tanks at school, that sanitizers are stolen, because this is the kind of bureaucracy we've had. What this pandemic has done is to expose the dark side, the incompetencies and corruption that is inherent in our public service. So you can't expect a public service that has not been performing at its A game for the last year and expect that public service, when you have a health crisis, to quickly turn around and give you perfect results. What we are getting now is exactly what we should be getting, because we have the kind of public service that we have. So for anyone to have expected this public service to be excellent, it was really, misguided. It's a misguided thought.
Kilebogile, do you agree with that? Hi, Kilebogile, are you still there? Okay, we seem to have lost Kilebogile. Prof, let me move over to you. Do you agree with that sentiment that Professor Ndletjana has just shared in terms of the capacity of the state and the capacity of civil servants?
Well, in terms of the international health regulations, they've always been there, and it clearly articulates what are the requirements. So if you looked at our indices from last year, it certainly would highlight the fact that, in fact, we do have a very fragile healthcare system. And, in fact, our levels of communication as well within our healthcare system and across communities was also something that was highlighted. So I think the evidences are there for areas that we needed to have in place to manage a pandemic or an outbreak of this particular nature. So I think it certainly highlights those concerns that are there, and how we try and address that in our actual current situation. How do we, if you like, we had that specific lockdown at level 5 with the particular point of actually trying to ensure that our capacities would be available, so that in fact we do have the number of beds in high care or in ICU, the oxygen and so forth. So that was called lifting the line, in other words. So those are the types of questions that we really need to answer, is as we have these particular surges and we do notice the strains on the health system, perhaps lifting that line was not always at the level that it could be. But we will see as we reach the peak of this particular epidemic.
Yeah. And I asked this question also in the context of our high HIV/AIDS rate and also tuberculosis, for instance. And when we speak about these comorbidities, how many people do we expect in these hospitals, and whether or not these hospitals will be able to take that pressure?
So that was of grave concern, of course, because we have, as you know, the largest number of HIV-infected individuals and very high rates of TB in South Africa as well. But it's very important to note that, in fact, those comorbidities that I mentioned, such as the obesity, diabetes, the hypertension, the cardiac diseases, are still the main causes of mortality, and age as well, obviously. So comorbidities plus age certainly lead to poorer outcomes. HIV and TB certainly contribute, but not to the extent that in fact we were concerned. So it's not as if we're certainly brushing that off. I think it's still an important consideration, but in terms of the poorer outcomes, it's those comorbidities that we really need to focus on. So again, we come back to how do we shield those individuals given the fragile nature of our healthcare.
And Professor Ndletjana, speaking about that and all the comorbidities and a section of a population, for instance, that suffer from these comorbidities and having the largest number of HIV/AIDS infection rate in the world, comes the question around what happened just after Thabo Mbeki had left, and that is the question around when we speak about skills and development of skills in the country. So these skills have been developed, but now these skills could also fall prey to COVID-19 and we could lose those skills. Is that a genuine concern?
Meaning skills in the public service,
meaning in general, the skills that the country has been able to build, whether we speak about the professionals in hospitals or we speak about the professionals in universities, we speak about the engineers, because these are some of the people, of course, who also suffer from some of these comorbidities.
Yes, that's quite true. But you see, that's a very important point, but I have a much bigger problem here in that our public service, and this is something that I'm afraid I have to harp upon, is that our public service has not strictly been meritocratic. That is why, for instance, if you look at in teaching, right, they close for a month, preparing to provide all sorts of things, logistical things to schools, so that when the schools reopen, these things would be available. Schools reopen. In fact, the schools could not reopen because these things had not been provided, right? And yet, it's a simple thing of planning and people doing their jobs, but they didn't do that. Then you go to hospitals. In my hometown of Port Elizabeth, Livingston, which has been one of the greatest hospitals we have had in this country, is pretty much falling apart. And because there's lack of management, there's lack of expertise, there's lack of commitment to jobs, to one's job. So, and what has happened actually in PE, especially in the Eastern Cape, is that quite earlier on, the private sector, VW and a couple of doctors and civil society folks got together to organize a response to this pandemic when the Bishop government had gone completely quiet. So you have an indifferent political leadership, you have mediocrity in the public service, you do have, of course, some good people, but the bulk of whom, because we have not been strictly meritocratic in our selection, and we've been lax in getting people to do their basic jobs. So this is a culture that we've built over the years, right? Over the years. So what is abnormal to them is normal. Laziness and not doing your job, simply not caring.
And stealing, by the way.
So when you have a health crisis, Sorry?
And stealing.
And stealing, true that. So when you have, you see, Arjen, there's this absurdity that we have, that we pretend to be surprised when people are not doing their jobs. Because we know that these things have been happening all along, right? So when you have a health crisis, Arjen, you tell me, and this is a basic point, right? Do you expect those people to perform brilliantly when all along they've been mediocre? They won't. They won't. So chickens have come home to roost. We are getting exactly what we deserve because we have not been insisting on excellence on everyday basis, even when things are normal, right?
Yeah.
So mediocrity has become a culture. It is self-sustaining. So when you are calling upon these folks to do what they are meant to do, it's difficult to them. They are complaining. Some of them don't even want to go to work, like teachers.
Kilebogile, let's hear your take on that.
Sorry, I was cut off for a bit, so I'm not sure what the...
Just on the capacity of the state. So one of the points that I raised with Professor Ndlechana was around losing skills, whether it is skills within the private sector or skills within the government sector, but just people who are part of this population and susceptible to the virus itself, who may die, and we may have an issue around skills. But then to your constituency that you also represent, there's an issue around children being orphaned.
Yeah, I mean, definitely. So we know that with high poverty levels and high unemployment levels come problems with nutrition as well. And so you find that the same person who has a comorbidity due to the fact that they grew up in a certain they grew up with certain disadvantages, is the same person who will then have to risk their lives to get on transport to work because they don't have enough savings to stop working at this time. And so we are going to see a significant loss in skills, in many different skills, across the board during this period of time, which will be devastating. It will have a devastating impact on our country.
Okay. Can you then also touch on what Professor Ndlechana has raised, and that is the capacity of the state as well, that, listen, this has always been the case. We can't expect of civil servants to now all of a sudden be excellent.
So and I think initially when I was talking about a lot of the issues in the informal sector, a lot of the issues that many different informal sector organizations had been advocating for are pre-existing issues before the time of COVID, and so definitely we're seeing that. We're seeing the effects of unfortunately a lack of capacity, I guess, for lack of a better word, to solve a lot of these developmental issues that we have as a country. And so now we find ourselves in a pandemic, and it really is exposing some of the shortcomings that that we have allowed to continue in the past.
Yeah, and Professor Puring, your take on that?
Yes, I think as we approach the peak, and we're going to reach the peak, and then we're going to have the decline in the numbers of cases. And I think it really comes back to the points about our preparedness, because transmission will be ongoing for a while. As I said, we still do not have a vaccine. We still do not have any medical interventions that are going to stop the transmission of this virus at this time. So I think it's another opportunity as far as is possible to make sure that as we go through this peak, that in fact we relook at our preparedness and readiness. Because again, if we have increases in surges, which is likely, are we going to be ready to manage that?
What are the predictions telling us?
Well, it's very difficult. I think we're still at this first phase, if you like. Again, I'm not sure that we're really going to have waves of infection. We may just have ongoing transmission. So again, it is likely that if we don't control that, we're just going to simply have surges and waves and so forth. And again, how are we going to manage that? I think to expect us to go back to lockdown level 5, I think it's going to be very difficult, given the challenges of our economy, for example.
Yeah.
The levels of poverty, the levels of unemployment that we're currently seeing, and how are we going to manage that? If that is the case, which is likely, how are we going to be able to ensure that our capacity to manage those patients is going to be in place? Because we've seen that although we had a strict lockdown to try and reach our capacity, but it goes back beyond that particular period in terms of our history to at that particular point. So it's not going to suddenly happen, but I think we really need to try and see how we're going to focus on trying to ensure that we do have the necessary capacity. But I think it's going to be a great challenge at different levels in terms of human resources, finances, and so forth. These are all the factors that will come into play.
And Professor Ndletshana, in closing, I guess that's the other difficulty, having to handle all of this and having to balance all of it when Rhodes University, a research from Rhodes University is telling us that over 3 million jobs have been lost already. On the other end, you've got people who are calling for further lockdown or hard lockdown, going back to a level 5. And then on the other end, you have people who are losing their jobs, losing their incomes, and who are part of the constituency that Kilebogile represents?
Well, I mean, this is a serious dilemma. We haven't been through this, so it's very difficult to handle, and it pits health issues and income, right? Because if you get people to go out to work, that threatens their health. At the same time, you might put in measures to protect their health, which then means that the economy is taking a dive. And when this thing has gone, there won't be any jobs left there. And this is the thing about how we then judge government. Obviously, very few people are going to be very happy with this thing because you have different constituencies with conflicting interests. Some want to go back to work, others don't want to go back to work. So there isn't a perfect policy that government can come up with, a perfect outcome. The only policy option that
But what would the
government can
best
go
outcome
for,
be?
well, is that you have fewer deaths and still has a functional economy. But how you exactly strike that balance is the tricky part of it, right? So what you should do is to go for a policy option that has the least shortcomings. But you will not have a policy that has no negatives. Yeah. There will be negatives, and you just have to hope that you've taken the best decision with the least negatives, and hope that people will understand that you did your best.
Yeah, well, thank you so much, Professor Ndletshana there, as well as Professor Adrian Purin, as well as Kilebogile Kuno. Really appreciate your time. Let's just quickly put up the poll that we've been running on our social media site and see what the outcomes are there with regards to whether or not we are winning against the fight against COVID-19. Can we get the poll up? Okay, the poll is not up. Okay, we've come to the end of today's show. Okay, here's the poll. Is South Africa losing the fight against COVID-19? And this was the question that we asked earlier on. From the votes that we've got so far, over 1.9 thousand votes that we've received, the results indicating at 67.6% that yes, South Africa is losing the fight against COVID-19. But as you just heard there from the two professors, at least, they believe that that is not the case. And hopefully it's not the case. But as it stands, we are number 5, 5th highest number of cases of COVID-19 worldwide. We've come to the end of today's program. Thank you so much for all your contributions. Let's do it again next week, same time, same place. From me, Aldrin Sampier, and the rest of the team, it is goodbye.